Hello and welcome to the Texas Mind Exchange. My name is Cody Gould and I am your host. Today we talked with Anthony Winn from Hill Country MHDD. Hill Country is the local mental health authority here in Central Texas, and we covered a variety of different topics, including what a mental health authority is, new resources for both urban and rural residents for them to help those who are in need of service, as well as talking about resilience and its role within therapeutic practices. It was a great conversation. I'm excited for you all to listen, and without further ado, welcome to the Texas Mind Exchange. Welcome, everybody, to the Texas Mind Exchange podcast, where we talk through a lot of different types of mental health initiatives within Central Texas. I'm excited to introduce Anthony Winn from MHDD, which is our local mental health authority here in Hays County. You are the Senior Director of Mental Health at MHDD, is that right?
Yes, that's correct, at Hill Country MHDD Centers.
Great. Okay. Yeah, I saw that. Did you recently get a promotion or no? Because I feel like I've seen a couple of different.
I did. Yes.
Congrats.
Thanks.
That's great.
Yeah.
I'm excited to learn more about what the Senior Director of Mental Health does within a, mental health, authority that serves, like we talked about right before filming this, how many square miles do you all serve?
Over 24,000 square miles. 19 counties we have 19 counties as part of our catchment area.
Wow.
So pretty large area that we serve.
Yeah, that's a lot. And I'm going to, being as though I am entering into the mental health world, I'm working on my LPC, LMFT, haven't decided which one yet, as well as doing this full time. And I think very commonly we talk about what a mental health authority is, what they're responsible for. But for people who might not know, can you help us understand what a mental health authority is and kind of what their role is?
Yeah, absolutely. So the mental health authorities in Texas really have two functions, right? So you've got the authority function, which is looking at eligibility for certain services, authorizing individuals into a level of care for what we call Texas Resilience and Recovery Services is a good example of that. But we also, through our crisis services, determine whether or not someone is in need of inpatient hospitalization, and help to place folks on the inpatient care wait list if that's necessary for a state hospital. But we also serve as the safety net provider for our local communities, which means that we'll serve individuals regardless of their ability to pay. And so that is a primary function of the local mental health authorities in Texas. We operate as that community mental health center for those communities.
Gotcha. Does that mean that you all very typically work with other nonprofits simultaneously?
Oh, yes.
Okay.
Yeah.
Cool.
Collaboration is a huge part of what we do in all of our counties. And so that includes collaboration with other units of local government, as well as nonprofits, for-profits, really anybody who's willing to come to the table and help with mental health. We are happy to partner with them.
Yeah. I was talking recently with Pastor Todd from Abundant Life Christian Church here in San Marcos. He told me that you all were talking about something, and you don't have to tell us more details about that, but I think that is really cool just on the surface of you all working with local churches and other local initiatives. Is that mostly to kind of get people involved within obtaining mental health services, or just kind of like a funnel for them?
Yeah, it's really a way to help increase access to care, which is critical, right? And so that looks different in every community. In many communities, it looks like partnering with the church. Working with Pastor Todd is a good example of that. Big fan of his, by the way.
Yeah.
But also in some communities, like in Canyon Lake, we actually have space in the fellowship hall of the church where we operate a mental health clinic out of. And so it's really building those relationships in the community where it makes sense and really helps to build trust with the members of that community, right? And so I think sometimes that's churches, sometimes that's the food bank, sometimes that is, local resource centers. We do a lot with the CRC out in Blanco County and Llano County as a good example of that. And so, again, we're really just interested in partnering with anybody that we can in furtherance of that goal of increasing access to care.
Gotcha. Yeah. And that leads me to ask, what do you think the biggest barriers are to care? Is it access? Is it people don't know where to go? That's something that we've found with our centralstate.com, which I talk about more towards the end of this podcast. But providing resources so people to understand what resources are out there for them that they can go and seek.
Yeah.
Is that something kind of like that you see as a barrier? People just don't know where to turn?
I do. I see it as one of the barriers. And there are quite a few that we really try to mitigate every day. So one of them is just lack of knowledge of the resources. And I would say that is one that a lot of time does get spent on, not even just by us, but from other community members. Like, for instance, again, I know the CRC does a lot of work around trying to educate the community about different resources. But really even just looking at the sort of non-medical drivers, right? So thinking about transportation, Texas is a big state. I mean, a big state. I do a lot of driving myself, right? Some individuals in Texas live 2-3 hours away from their closest mental health clinic, and there are no local providers. That's a huge barrier. Sometimes people can't afford gas. Sometimes it's that they are not sure where their next meal is going to come from. And that, understandably, is the primary thing that they're worried about. And so really addressing those non-medical drivers has become really crucial for us in our work. And again, a lot of that's through partnership. Some of those are outside of our direct scope, but they are areas in which other resources can help. And that's why it really does take a whole community to address many of these things. It's also a big reason why we've started looking at telehealth as a major option for getting services out into more rural areas so that we can eliminate that drive. And actually, more recently, one of the things that we've done that's really kind of cool is we are having some mobile clinic vans built that have built-in internet in them that are synced up with our electronic health record so that we can roll a clinic out to one of our more rural communities, thinking about a Schleicher County, for instance, and provide services there where people live. And so that's, just again, another example of how we're trying to break down those barriers. And transportation probably comes up as the number one barrier time and time again.
Wow. Yeah. I mean, I guess that on the surface totally makes sense. Something I think we overlook constantly because we take for granted that we have a car, or we have access to the highway or what have you. That is so interesting. And I was going to ask about telehealth, but I was not expecting the answer of telehealth, but also you have these, I guess, buses or like vehicles that you outfit to.
Yeah, so they're modified vans. We're actually going to be traveling next week out to another LMHA to look at how they've outfitted their vans that they just purchased and how they're deploying them to kind of learn from what's already happening out there. So I'm really excited about that. But essentially, they are fully equipped. They're vans that are fully equipped with what you would need to provide services as though you were in a clinic.
Wow.
Which is really, if you had asked me 10 years ago if that was a possibility, I would have said, I really don't think so. But we're there, right? We're at a point in time where the technology exists to do that. And I'm really proud to work for an organization that's exploring that and wants to do that.
Yeah, that's amazing. Really cool work. And you asking me 10 years ago, I would never have this, and would never have a thought that this would be possible. Tell us about your journey. How did you end up as Senior Director of Mental Health, at MHDD? Where's the background? We would love to hear that.
Yeah. So actually my journey in mental health, started at Texas State University. Go Bobcats.
Yeah.
I got my bachelor's degree in psychology at Texas State. At that time, really didn't know exactly what I wanted to do with that or what that looked like. But I became actually really interested in forensic psychology in particular. And so I went to the University of Houston, Victoria, and got a master's degree in forensic psychology. And continued through the LPC licensure track, and ended up just really enjoying doing direct care. And I actually started at a different local mental health authority while I was working on my graduate degree. And when I got my graduate degree, I got hired on in a private practice, and I went and did that for a little while. And while I was doing that, I really just kept coming back to community mental health as being the place where I needed to be. I love the pace of it. I love the people that we work with. I feel like the people that we work with in community mental health centers are the ones that really need us the most. And so I decided that, private practice isn't for me. I need to go back into community mental health. And that's when I came to Hill Country. And started out as a therapist in our New Braunfels clinic, doing a lot of diagnostics, doing some cognitive behavioral therapy. And then when we got funding to create our Canyon Lake Clinic, I threw my hat in the ring to lead that clinic and be the first director there, and was fortunate enough to be able to serve in that capacity. And in my work there, I really learned a lot about how to run a clinic, and was able to move into the position of our director of clinical operations, overseeing all of our clinics. And here more recently, I moved into this position, the Senior Director of Mental Health, which allows me to continue to oversee the clinics with our Director of Clinic Operations, but also expand into our crisis services, our forensic services, and our peer services, so on and so forth, and help blend all of those really critical elements together from a day-to-day operational standpoint. And so, my experience, I joke with our staff, I often go meet with them when they're going through what we call mental health competency training. And I tell them, at this point in my career, I've had the opportunity to do pretty much everything in a clinic, with the exception of giving an injection, which is good for everybody, right? And I really take pride in that because from reception to our care coordinators to our therapists, I know what it's like to be in their roles, and I know what kinds of stressors they experience. And I think all of those experiences have helped me to become a better leader without losing sight of what's truly important. And that's the people walking through our doors, right? That's the people that are coming and asking us for help and being vulnerable. And so that's just a little bit about how I got here. It's been a fun ride so far.
Yeah.
And I'm excited for what's to come next, honestly.
Thank you for sharing that. We might have to start a new podcast and bring you back to talk about leadership and servant leadership training and all that sort of stuff.
Sign me up.
Yeah, that's next on the docket. We'll do that. Okay, 2-something million miles, right? No, 19 counties you serve?
19 counties, a little over 24,000.
24,000.
Yeah.
A million miles was a little over exaggerated. I'm sure it feels like a million miles.
Some days it does. Some days it does.
I'm sure that there are so many things that kind of come up and, potentially are challenges, especially serving so many people in so many different counties that are so far away. What do you think are some of those the bigger challenges that you all face in regards to kind of, I guess, day-to-day activities and challenges that you go through to kind of help serve the community that really needs to be served? Maybe besides, obviously, transportation. Is there anything else that comes top of mind?
Well, every community is different, right? I think about Blanco County is very different than Uvalde County. Hayes County is very different from Kerr County. And so there are differences that are derived from population size. There are differences that are derived from culture. And so I'd say probably, one of the more difficult things from an operational standpoint and a logistics standpoint is just being well-versed in each of those communities, understanding their dynamics, and working within those, right? Because I cannot expect a community to operate the way that I think they should operate. This is their community. And I think it's incumbent upon me and my team to learn that community and understand what's important to them, what their gaps are, and what their strengths are, so that we can better serve them. That is both a privilege and a struggle on a day-to-day basis, right? It's one that I'm happy to continue to do, though. And I think we've come a long way as an organization in that respect. Really getting to know our communities on a deeper level, understanding what the needs are, and understanding, who our partners are in helping to make that happen.
Yeah. That adaptability, being able to go from one county to another and change with the I guess, circumstances and requests and needs of those people is what's going to, I guess, set apart, decent giving back and work, and compared to the excellence in which you all bring. So that totally makes sense to me. I think that leads me to ask, how many local mental health authorities are there in Texas? Do you know off the top of your head? I don't know. I think that's a decent amount.
Yeah, 39.
30. Oh, okay. You do know off the top of your head, 39. That wasn't a quiz. But I guess 39, I guess that means that there are 39 different organizations, I guess, looking at problems and looking at serving their community in a slightly different way, which I guess is amazing from one perspective, because that means that those organizations are unique. And that leads me to ask you all, what about Hill Country MHDD is unique to you in a way that you look at serving?
Yeah. So I think that what makes us unique, and what I'm probably most proud of with our organization, is that we always come back to what is best for the person being served, right? And that's top to bottom, right? That is everybody in our organization. Our CEO, our deputy CEO, myself, down to our receptionists, right? Everybody thinks about what is best for the person served and agrees that's what we should do. The rest will work itself out. I have not always worked in organizations where that is the case. But that is one of the big reasons that I have stayed with Hill Country and will continue to stay with Hill Country, is because that value system is so deeply ingrained in the fabric of us as an organization. And I think it's what's going to make us successful. And more importantly, it's what keeps our services quality, because the people coming through our doors deserve that. They deserve our best every single day, and we commit to bringing that to them. So I think that makes us somewhat unique, and I'm very proud of it. Now, I can't speak for the other centers, and I'm sure that they are also working toward that and doing that. I have the opportunity to speak with a lot of the leaders at other centers on a regular basis, and they're all great people as well. But I know my experience with Hill Country has been that we really always defer to what is best for the people that we are serving in any given situation, in any given problem, and truly believe that that's a recipe for success.
Mm-hmm. Person-centered. That's what I hear.
Very person-centered. Absolutely.
Yeah. Yeah. That's the way that change is really made. And I think that sometimes can be a fear, is looking and kind of looking at issues and generalizing solutions, when that's not going to potentially help exactly what that person needs. And being able to kind of pinpoint what their requirements are for change or success is really important and part of the puzzle that we can't miss out on.
Absolutely.
Yeah.
Yeah. Well, and everybody, not just everybody living with a mental health condition, but everybody has a different set of circumstances, has a different set of struggles, has a different set of pains in their life. And you can't cookie cutter that. And so for us, it's just making sure that we are understanding what is important to this person, what is meaningful to the person that we're serving, and how can we help them reach that goal, right? Often people are coming to us because they need some guidance, but we also need to understand, where do you want to be? And we can help guide and get folks there. And so I think we do a really good job of that. And I think we are really good at continuously looking at ways that we can get better at it. We never take our eye off of that. And I think that's critical too.
Yeah.
We can't get complacent, because we do still have work to do. I don't know that will ever change. I think that's just part of the DNA of the mental health profession. Yeah.
Adaptability.
Yep.
And adaptability, being able to cater to the needs of what people are looking for. Guidance, I hear. Yes. And if we're practicing improv, the world of mental health has expanded over the years. There have been tons and tons of changes with licensure, changes with different degrees, changes with how people are served. What do you think that what do you think the future of mental health is? And if that's too big of a question, what do you think the future of Hill Country is, maybe in the next 10-ish years?
Yeah. So it really is hard to say, because there are a lot of different things happening right now in the mental health world. I suspect that we are going to see more emphasis on the use of AI, mostly to help with the documentation burden, but also taking a look at how AI can help us triage folks to make sure that the people who need services more urgently get them more urgently. I think AI is going to be a big part of that. Don't know exactly what that looks like yet. It's still really developing. It's in its infancy, to be honest. But I'm excited to see what that looks like. It will never replace the person, right? Because when we're really the basis of healing in general is connection, right? And so I don't want anyone to hear that that's going to be replaced, because frankly, it can't be. But what I think AI can help us do is free up more time to connect more. Right now, so much of our time goes into proper documentation, proper reporting, doing all of the administrative functions of a mental health professional. Mm-hmm. if we can free up some of that time, that leaves more time to connect and provide service and ultimately increase access. So I think AI can be a big part of that.
Mm.
I also think that the certified community behavioral health clinics are going to be a big part of the future. And that's something that Texas actually as a state has leaned heavily into, is having all of the local mental health authorities certified as a certified community behavioral health clinic. You've probably heard CCBHC.
No, I actually haven't. I would love to hear more about like what that is.
Yeah. So it is a long, stringent set of requirements that we have to meet. But really at its core, what it is a system of accountability to ensure that we are working to increase access to care and improve quality. And one of the things that I mentioned earlier, right, was that we're always looking at ways that we can get better. Well, that's a central tenet of being a CCBHC, is that you're always looking at continuous quality improvement, right? We're looking at, all right, how can we improve the speed in which someone gets enrolled in our services when they come and ask for help? How can we improve the speed with which they get the service that is necessary? How can we improve the quality of that service? And so we're always looking at how can we be better? And I think that is one of the fundamental elements of being a certified community behavioral health clinic, which I'm proud to say we are. I believe that is a big part of the future, though, in Texas and really nationally.
Yeah, AI, community behavioral mental health clinic. Anything else that you think that you see coming down the pike for the future?
I think that everything mental health sort of comes in waves, right? You look at, for instance, in the 60s, right? I'm gonna dive into theory a little bit here.
Let's do it. Yeah.
So in the 60s, we had humanism, right? And talked a lot about unconditional positive regard, and really hearing the individual out. That then sort of went away and got overshadowed by other evidence-based practices like cognitive behavioral therapy. We started diving more into behaviorism. And now look at where we're at. We're looking at person-centered care. So I think that we will continue to see themes as we move forward that are akin to things we've seen in the past. The difference is, I think we're going to start to see some of these theories really blend, because at the end of the day, we're all talking about the same thing. We're just using different words, right? CBT doesn't work without unconditional positive regard. I often say that CBT is sort of like the engine, and unconditional positive regard or rapport, that connection with the therapist, that's the oil, right? One doesn't really work without the other. And so I think we're going to continue to see a blending of some of these theories that have been written and studied over the years. I'm hopeful that we will see more emphasis on resilience and how we can help people to really build resilience throughout the life cycle. I think that is something that's sort of been lost in the positive psychology movement. We've almost omitted the idea that pain is part of the human experience. And I think that's dangerous, right? Because the reality is we're always going to have some pain, right? There's always going to be suffering in our lives. Sometimes we'll have more, sometimes we'll have less, but we got to know how to manage it. And we have to build that resilience and our ability to cope with that to maintain our ability to stay healthy. And so I don't know yet if the future holds an increased emphasis on resilience, but I certainly hope so.
Yeah. I mean, here at THRC, the Translational Health Research Center at Texas State University, resilience is one of the cornerstones that we talk about all the time, whether it be mental health resilience or soil health resilience, or, the list goes on and on. But resilience is I guess, seemingly a thread that we talk about. And that is interesting. I guess I never really thought about resilience never having as much focus on it as it does now. And yeah, that's the emphasis of resilience is a theme that I think that I'm seeing in my selfishly in my personal life of like, how do, and I guess that is kind of, how do you react to the world that you're living in if it's potentially not the best? A lot of that is cloaked in behavioralism and kind of like what is within your control or not in your control, and how do you adapt your mindset in accordance to some of those factors. But kind of bringing it down to a level that everyone can comprehend of referring to that as resilience is interesting, because I feel like it could have tons of amazing ripple effects, to younger generations, to really emphasize resilience. Life might not work in certain ways that you've hoped. How do you bounce back from that? And I guess from an organizational standpoint, I'm sure you talk about resilience a lot. I'm sure that there have been kind of things that have popped up. How have you all as an organization kind of bounced back and have built up resilience, just pertaining to making sure that people receive their services, and make sure that you guys are kind of upholding the standard that you want to uphold?
So organizationally, I got to point at COVID as a way that we built resilience.
Yeah.
Because overnight, right, we, just like so many other organizations, were rendered to being virtual. Everything was virtual. And that was a new world for us. But we were able to make that shift, make it quickly, and keep our eye on what was still the most important thing, which was the people that we were serving, right? Not only that, we were able to learn from that. COVID was painful, right? It was painful for everybody. But organizationally, it was painful because we had become used to doing business in one way and providing our services in one way. And we had to shift that. We've learned from that, and I think now have become a much more flexible organization, a much more adaptable organization, and we're able to make those quick shifts because we were forced into that with COVID. And so I think about, how we as an organization have been able to show resilience. That really sticks out to me, because that resilience, that bounce back, is really about how do we learn from this? How do we really take this lemon and make lemonade, to use an old expression, right? And man, I think that as an organization, as a team, we did an excellent job of that. And there are so many other organizations that did as well. It's just phenomenal to me that so many organizations, so many businesses made it through that. But yeah, I mean, that sticks out to me. I think another example of resilience as an organization was our response in Uvalde after the tragedy. We had a team there immediately. Our clinic was 2 blocks away from the school. And we had some staff that were traumatized, some staff that were affected. And we dropped everything as an organization and said, that's our first priority. We need to support our staff. We need to support the community. We need to do whatever we can do. And we need to do it long term. And we have continued to do that. And will continue to do that. That has really taught us a lot, though, about how do we communicate with our other communities about threat assessment. What is our role in threat assessment? And so again, we took a very bad situation, an awful situation, and collectively decided that we wanted to learn from it and take those lessons to benefit others. I don't know that there is a better way to capture organizational resilience than doing that.
Yeah, those are amazing examples, and heavy ones. And I think that it's important that we talk about both of those heavier examples, because in the world of mental health, those are kind of the type of situations that we unfortunately deal with. But organizational leaders are able to respond to that.
Well, and I think, again, resilience isn't really resilience until you're doing it when things are difficult, right? And so you can't really talk about it without talking about painful experiences. And that's something that I always would talk to my clients about, right, when I'm in the therapy room. I'd have folks come in and say, I had this happen today. I want to focus on this, or I need to talk about this, or I'm too upset to talk. And I would remind them, this is the perfect time to do the work, right? If we're only talking about it when it's easy, we're not going to make progress. We got to talk about it when it's hard. That's where resilience starts. It's like working a muscle, right? If you stop running every time you get winded, you're probably not going to develop that muscle, right? Your lungs aren't going to get stronger. You're not going to be able to deal with as much. But the more you do it, the more you push, the more you take that next step, the better off you are and the more resilient you become. And that is really so much of the bedrock of the work that we do in the mental health field. Is to help empower folks to take that next step, to build up that resilience muscle, so that whatever comes at them in life, they can handle.
Mm-hmm. Yeah. Thank you. Thank you for sharing that. I feel like we've covered so much in regards to your background, Hill Country MHDD. With that said, if anything, what do you want people to know about Hill Country MHDD that people might not know?
I think that the take home I want people to know about our organization is that the care is real, right? And I know that's cliche, but I have been in all of our high-level conversations for quite a while now. And that is such a theme, is that at the end of the day, we care deeply about the people that we serve. And we want their lives to improve in the way they want them to improve. That can get lost when you're talking about a large organization, a unit of local government. It's easy to think of, us as folks that are just doing a job who don't really care what happens. But I'm here to say it couldn't be further from the truth. We care deeply, and I think that really shows throughout our organization. And I mostly say that for the people who may be thinking about coming in for services and aren't sure. I would encourage you just walk through our doors.
Yeah. It's the first step.
It's the first step.
Yeah. I love that. As I mentioned, along with working within the Translational Health Research Center, I'm also in school, and I have a question personally that I would like to hear.
Yeah.
I don't know if hopefully other people would like to hear. If you could give advice to a younger version of yourself, knowing all that you know now, having all the experiences that you've had, maybe someone in my position that's in first semester, second semester of school, going back to get their LPC, or LMFT or other licensed social work, what advice would you give?
There's a lot there. I think if I had to boil it down and give myself the most critical piece of advice, it would be to always follow through. Because that's important in so many different facets of life, right? That's important in your personal life. I think about with my kids, right? If I tell them that we're going to do something, we better do it. That's how trust is built. As a therapist, if I tell my client, this is the direction I think we should go, or this is what we're going to be working on next week, or here's where we're going to pick up, got to follow through. That's how trust is built. As a leader, right? If I tell my team that I'm going to get them something, or that we need to dive into a certain problem, and I'll take lead on this piece of it, I got to follow through. You always have to follow through and take that next step. That's how things get done. That's how you build trust. That's how you build connection. And it seems like such a small thing, right? But often those are the most important things in any sort of relationship, whether it's a working relationship, therapeutic relationship, personal relationship. The small things make or break it. Irvin Yalom talked a lot about that. It was often the small things that his clients would tell him made all the difference. Opening the door for them, handing them a bottle of water, right? Following through on that promise of, I'm going to give you dignity in our time together. I think that would be the biggest piece of advice for myself, is always follow through, always do those small things, because they add up and you get big results from them.
Yeah. Thank you. I appreciate that. If people want to follow up with you, what's the best way of getting in contact?
Yeah. So if you go to our website, hillcountry.org, there is a contact us link to be able to send us a message. Reach out with any questions you have. If your question is specifically for me, you can say that and they'll get that message to me. They're very good about that. Yeah. And that's probably the best way for most people to follow up. And for those of you that may be interested in our services, going to our website and just looking at which clinic in your county which clinic is closest to you and what the address for that clinic is.
Great. Well, Anthony, we appreciate your time. Thank you so much for joining us today. And
it's been a pleasure.
Thank you so much.
Thank you.
Great.
Thank you for having me.
This podcast was presented by thecentralstate.com. Thecentralstate.com is a consortium focused on improving resilience in Central Texas by using evidence from research to improve human and community health. This website highlights health and research data by county and opportunities to find funding and resources for mental health programs in our area. Additionally, there are interactive calendars that keep you up to speed regarding what is happening right here in Central Texas.